Namaskar. Good evening, all the viewers and the members of WHRF, Women's Health Research Foundation, to this wonderful evening and a new session on irritable bowel syndrome. As we all know that we've been talking about different topics on every weekend, Sunday evenings, bringing up different experts from various fields to talk about their experience. Women's Health Research Foundation is a trust recognized by the Government of India, affiliated to the Yogaguru Institute, working in the field of women empowerment and development, providing them with education in yoga and arranging for their placements in different sectors of the society. So today's guest is Dr. Neeraj Jain ji, and I'm proud to welcome him to this session, informative session on irritable bowel syndrome. Welcome, Dr. Saab, and please share your experience and knowledge with us. Over to you.
Thank you, Ms. Rachna, for this kind introduction. I am grateful to the Women's Health Research Foundation for inviting me to give a talk to this august audience. And particularly, I'm glad that they've selected a topic such as irritable bowel syndrome. Now, irritable bowel syndrome is something which we all have to understand, because 20% of the general population will have symptoms and they will be suffering from this problem, which is again a functional bowel disorder in which there is abdominal pain associated with defecation or change in bowel habits. Irritable bowel syndrome is the most common cause of GI referral, so we get many patients who have this problem. Young females are affected 2 to 3 times more than men, but I suppose this is more common in cities, but does not hold true for villages. There are other coexisting conditions. One may only think of IBS as something pertaining to the pain in the abdomen, but no, there may be non-ulcer dyspepsia, that is acidity, chronic fatigue syndrome, dysmenorrhea, fibromyalgia. Now, fibromyalgia is something which the Ayurveda would say is Vata rog, or wind in the joints and muscles, which causes pain everywhere. Headache, nausea, and heartburn. These are other symptoms which can coexist with irritable bowel syndrome. When we come to pathophysiology, or the cause behind it, it is mostly found that there may be behavioral and psychological factors. Though most patients have no psychological problems, but 50% meet the diagnostic criteria of psychiatric diagnosis like depression, anxiety, somatization, that is conversion of mind symptoms to the body, and neurosis. So there may be some link to the psychological, psychosocial factors which can initiate or make this condition worse. Acute psychological stress and overt psychiatric disease are known to alter the visceral perception. Visceral perception is our understanding and feeling of the organs inside our body. And so such people who have irritable bowel syndrome are more aware of their movements inside the intestine, the water going somewhere, food going somewhere, and gas moving around. So when people are so much aware about their viscera, this is known also as a gut-brain syndrome. In Ayurveda, we call it Mat Bhari to Aat Bhari to Mat Bhari. So there is a great link between the mind and the gut. There is an increased prevalence of abnormal illness behavior with frequent consultations for minor symptoms. So it is noted that people who have irritable bowel syndrome generally consult doctors many times for other conditions also. So it is part of their nature, part of the IBS, so that they have frequent problems besides abdominal problems. So these factors contribute to, but they do not cause irritable bowel syndrome. When we look at the physiology, there are many chemicals. So we can't say that this disease does not exist and there is no abnormality in the person. There are certain neurochemicals which are released and they cause either the diarrheal type of irritable bowel syndrome or the constipating type. And according to these only, medicines have been used to control these symptoms in severe situations. Also, if there is gut inflammation or immune activation, these cannot be detected by test with a raised number of mucosal mast cells, which sensitize the entire enteric neurons by releasing histamine and tryptase. So these are chemicals again which are working within our body to create symptoms, and that is why patients will also get better with certain medicines which are mast cell stabilizer like ketotifen. Immune activation may be associated with altered central nervous system processing of visceral pain signals. This is more common in women and in the diarrheal type of irritable bowel syndrome, and may be triggered with infections such as the Salmonella bacteria, which is responsible for typhoid, and Campylobacter species. The intestinal lumen or the gut itself, they also have both quantitative and qualitative alterations in intestinal bacteria. The gut microbiota, as we know, there is a healthy bacteria in our intestine. It is known that about 3.3 trillion bacteria reside in our intestine, and about 500 varieties of bacteria are there, and not all of them are bad. They are trying to help us. So if there is a change in this bacterial content, that also has been reported in irritable bowel syndrome as one of the cause. SIBO, or small intestinal bacterial overgrowth. That means there is an overgrowth of bacteria in some patients, and this leads to symptoms. This gut imbalance or gut dysbiosis explains the response to probiotics. Probiotics are again bacteria which we give to control or stabilize the bacterial flora. Also, non-absorbable antibiotic rifaximin helps in some patients to reduce the number of small intestinal bacterial overgrowth. So these are helpful things. So pre-probiotics are very commonly used and they help the intestine. Other may be chemical food intolerances. Now, this does not include allergy, because allergy is a very serious condition. In this, the food is not tolerated by the person. It is poorly absorbed, such as short chain carbohydrates like lactose, fructose. Lactose is part of the milk sugar, fructose is fruit sugar, sorbitol is vegetable sugar, and among others, they are all known as FODMAP, fermentable oligo, di, and monosaccharides and polyols. So these are found in vegetables, fruits, milk, and these can produce a lot of gas and sometimes irritability. Non-celiac gluten sensitivity. Now, non-celiac means that these patients do not have gluten or a wheat allergy, but yet they seem to present with symptoms of irritable bowel syndrome. So in patients with irritable bowel syndrome, we particularly avoid wheat and they get better. Some patients are intolerant to chemicals like salicylates. Now, salicylates are found in broccoli, cauliflower, mushrooms, zucchini, radish, and spinach, and they can also cause symptoms. Benzoates are present in certain foods as preservatives. So any packet foods are to be avoided when patients have more symptoms. Altered GI motility. Now, motility may be altered. So in constipating time, we have decreased transit time, reduced number of high amplitude propagated colonic contraction waves, but there is no consistent evidence of abnormal motility. So we can't say this is something permanent. It comes and goes. Predominantly in the diarrheal type, there are rapid jejunal. Jejunum is the small intestine. There are contraction waves. There is rapid intestinal movement, and there is increased number of fast and propagated colonic contractions. The large intestines also contract very fast and rapidly, and that causes diarrhea. Abnormal visceral perception. Now, IBS is associated with increased sensitivity to intestinal distension, and this has been checked by inducing inflation with balloons in the small intestine, that's ileum, large intestine, the colon, and rectum. And this, as a consequence, alters the CNS processing of visceral sensation. The viscera in the abdomen, we are becoming more aware of it because of these things. And this can be tested, of course. This is more common in women and in diarrheal predominant irritable bowel syndrome. If we look at the clinical features, the most common presentation is that of recurrent abdominal pain. This is very worrisome because a person may feel that there is something seriously going on. They go for tests such as ultrasound scan, CT scan, endoscopy, colonoscopy, all these things are done. because the main symptom is pain, which comes back again and again. Abdominal bloating. Now, bloating means that the abdomen becomes big and it worsens throughout the day. Altered bowel habits. So bowel habits do not remain the same. Either there is constipation or there is diarrhea. There may be passage of mucus, but rectal bleeding does not occur in irritable bowel syndrome. So that is a separate issue, and if that occurs, it requires further investigation. Usually there is no weight loss. On the contrary, people who have irritable bowel syndrome can gain weight. So physical examination is generally unremarkable with the exception of some abdominal tenderness, because in a bloated intestine, pressure on that intestine will cause pain. So clinical features are not very many, but symptoms are there. For this reason, since it was a sort of a ghost disease, the doctors got around in Rome to decide certain criteria, minimum criteria for diagnosing of irritable bowel syndrome. So number one was recurrent abdominal pain or discomfort at least 3 days per month in the last 3 months with 2 or more of the following. This pain improves with defecation. Onset is associated with a change in frequency of stool. Onset is associated with a change in form, that is appearance of stool. So the stool becomes either loose or broken or hard. So all these things can happen, and these conform to the criteria laid down by a group of doctors. Features of IBS. So main features are colicky abdominal pain, altered bowel habits, abdominal distension, mucus in stool, and feeling of incomplete defecation, and it is worse during periods of stress. So there is a link with the stress, that these conditions, apart from of course food and sleep, many things which change the milieu interior or the balance of the body, can bring about features of irritable bowel syndrome. The supporting diagnostic features in irritable bowel syndrome are that their symptoms should have been more than 6 months and requiring frequent consultations for non-gastrointestinal problems as well, previous medically unexplained symptoms, and stress that worsens symptoms, and especially people with irritable bowel syndrome get better on outstation trips, which gives them relaxation and they forget about the disease. There are certain alarm features in IBS, because if we are thinking about IBS and certain things which are associated, take us away from the diagnosis of irritable bowel syndrome. So if the age at first presentation is more than 50, we have to suspect that it could be something else. Also amongst male, the condition is less, but we see fairly a good number of males also suffer with irritable bowel syndrome. Weight loss, it's very important to note that weight loss is not a part of irritable bowel syndrome, and we have to think of some malabsorption, some disease in the intestine. Nocturnal symptoms, very important. Once the mind goes to sleep, the intestines also go to sleep. So if the symptoms occur at night, that means it could be something else. If there is a family history of colonic cancer, celiac disease, that is wheat allergy, or inflammation of the bowel, that is colitis, then we have to consider investigating that as well. Anemia is not part of irritable bowel syndrome. In irritable bowel syndrome, the person otherwise is very healthy. So anemia has to be looked at as to why there is anemia. There could be something else inside the intestine. Same goes for rectal bleeding and diarrhea, which is persistent, chronic. That is not part of IBS. IBS symptoms come and go. Difficulty in swallowing, vomiting. Again, this is a symptom which can be away from IBS and needs to be investigated. If the history of symptoms is very short, again, we have to think of other causes, but not irritable bowel syndrome. Only abdominal distension and some tenderness is found. And if we look for the tests such as full blood count, ESR, fecal calprotectin, which is a test for inflammation of the bowel, with or without sigmoidoscopy, that we have to do a scopic examination, they're usually done and are normal. Why they're done is because the patient is usually quite scared of some disease inside. So ultimately these tests are done sometime during the course of the symptoms. Colonoscopy done for older patients, particularly because there may be other causes in the age group, such as cancer. And all patients with diarrhea should have a colonoscopy, diarrhea which is not settling. And in case of rectal bleeding, colonoscopy is also indicated. Irritable bowel syndrome D, that's the diarrheal type, should be investigated to exclude wheat allergy, microscopic colitis, milk intolerance, bile acid malabsorption, thyroid disease, and parasitic infections. So there are certain conditions which we cannot ignore. At the same time, they are all normal in cases of irritable bowel syndrome. So when we come to treatment part, reassurance is very important. Once we have made sure that there is nothing else wrong with the person, then reassurance is most important, and this should be given by a good doctor who has made sure that there is nothing else serious with the patient. Diet may help, such as a wheat-free diet, exclusion of milk. But when we exclude milk, we are only talking about milk and not curd and paneer and chaach and lassi. Those things, buttermilk, all these things can be taken. And a low FODMAP diet. Salads and fruits in excess. Some fruits may be acceptable, but these also can cause symptoms, so these should be excluded. In resistant cases only, when all this has been done, we take the course to medicines like antidepressants and 5-hydroxytryptamine 4 antagonist. And we also give a trial with rifaximin, which is a local acting antibiotic, mesalazine, which reduces some swelling and inflammation, ketotifen, which reduces the mast cell action and may help in case of food intolerances. In most difficult cases, psychological intervention such as cognitive behavioral therapy, relaxation, and gut-directed hypnotherapy has to be used with the help of experts. Most patients have a relapsing and remitting course, and these relapses come about generally during periods of stress in our life. So if we look at the treatment of IBS, first is reassurance, and that sometimes resolves the symptoms, but it is not very easily done because reassurance can be given, but it also depends on the patient-doctor relationship, how much the patient will believe the doctor. Because the symptoms, if they are persistent, then we have to treat them, tackle them separately. For diarrhea, we avoid certain diets, give antidiarrheal medicines, give rifaximin, which is a locally acting antibiotic, antidepressants. And for constipation, a high roughage diet, isabgol, lactulose. We can use also tripla and bale. All these things can be used. For pain and bloating, spasmolytic drugs, which are antispasmodic, again, antitryptamine, probiotic, dietary changes, and then lastly, hypnotherapy and biofeedback can all be tried. So there are many modalities by which we can try to control the symptoms. So role of clinical psychologist. I would like to add that this is very important. Help from a clinical psychologist can be of immense value. There are patients who want to talk about their disease. The doctors have generally, the gastroenterologists have told them there is nothing. You just are worrying and whatever may be there, it is not a serious disease. So they need someone to talk to, and a clinical psychologist is very important in such situations. And they can, with the help of psychologists, learn to cope. And so they teach certain coping techniques in stressful situations. For general stress management, again, psychologists are very helpful in identifying trigger situations which can start the attack. So they should be identified and then neutralized as soon as they happen. And again, with all that, there is confidence building, and the person is reassured and is confident that the next attack will not be so disabling. At the same time, this reduces the dependence on medicines because medicines have their own side effects. Now, other therapies. There are complementary alternative therapies for IBS. They are manipulative and body-based, such as massage, chiropractic, mind-body interventions, such as meditation, hypnosis, cognitive therapy, biologically based, such as herbal products, tripla, bale, isabgol, dietary additives, probiotics, of course. And then energy healing. Energy transfer is done by experts such as Reiki, biofield therapy, bioelectromagnetic field therapies, and pran therapy, pranic healing. Alternative medical systems. Now, Ayurvedic, homeopathic, traditional Chinese medicines also offer certain medicines like there are in allopathy, and maybe they will work for some people. So all these things are available for patients with IBS, and they can be tried. Navel therapy is something which I came across with the help of Swami Aprokshananji. It is an ancient Indian science. Navel, known as Dharan, Nal, Nap, and Kodi, is known to many of us, and it plays a role in most of the abdominal conditions, particularly in irritable bowel syndrome. So, displacement of navel causes many diseases apart from IBS, and correction of this displacement gives relief. Certain asanas help to prevent displacement. So, once the navel displacement has been corrected, regular uh, use of Nauka asana, toe touching, Vajrasan, Supta Vajrasan, Bal asana are some of the asanas which are of great help. In Nauka asana, the body is shaped into a board with the raising of the head and stretched out feet. In toe touching, while you're sitting with your legs stretched in front of you, you touch your toes, and that also helps. Vajrasan is the thunderbolt pose, or in which you sit on your knees like the Muslims and Buddhists sit in their prayers. And Supta Vajrasan is while sitting in Vajrasan, you take the help of your elbows and lie back. Balasana is touching the toe of your foot to your head, first the right leg, then the left leg, and then both together. All these asanas, when done regularly, will control the displacement of navel, and symptoms are very well controlled. So I'm all for navel therapy and for yogasanas. Thank you very much for our patient hearing. Now to continue, I have been given some questions. The first, this is questions coming from your group. Can IBS be treated completely? Now we do say that this is a remitting and relapsing disease. It comes and goes, and with the stress, it causes problems. But yes, with all the modalities that we have, it can be treated completely. Regular hobbies, relaxation techniques, meditation, all these things will control this disease, and one day one may feel that there is no IBS. And I have many patients who have not had any symptoms for years, and then after very severe stress, it comes back, but then they recover very quickly. Next question was, what is emotional IBS? Emotion and IBS, there are not two different things. Disturbed emotions will cause irritable bowel syndrome. So yes, emotional IBS is not a separate entity. It may be separate to the extent that yes, a person can tolerate all types of foods and diet and chemicals, but it's only the emotions which pull them down. So we may say that there is one particular type of IBS which is only triggered by emotions, but generally it is a combination of everything. How useful is yoga practice? That's the next question. In keeping the gut healthy. I think there is no second best to yoga, because yoga in terms of asana, pranayam, and then dhyan or meditation is very, very helpful, not only in controlling irritable bowel syndrome and treating irritable bowel syndrome, but also for controlling many other lifestyle disorders such as hypertension, diabetes, sleep disturbance, weight gain, weight loss. All these things respond to yoga therapy. And if you are doing regular yoga and if you learn it from a good yoga teacher, then nothing like that. Thank you for patient hearing. If there are any more questions, Rachnaji, I will be very happy to take them.
Thank you very much, Dr. For this wonderful session. I think these three questions were mainly coming up from our team. Can you stop, please, sharing the screen, Doctor? Then,
okay.
Yeah, we'll go on further. Yeah, thank you so much, Doctor. And before concluding the session, I would like to elaborate on the introduction of Dr. Saab. He is an alumni of Armed Forces Medical College. He did post-graduation in Gastroenterology from UK. He is also associated with Swami Aprokshanand Saraswati Ji of Rishikesh, from whom he learned the art and science of navel therapy. He has translated a book written by Swamiji on navel science in English from Hindi. He has almost 36 years of experience in gastroenterology. Presently, he is a consultant at Pushpanjali Medical Center in East Delhi. I'm so grateful to Dr. to have taken out time from his busy schedule for this informative session and explaining, giving us knowledge about how this IBS, which is a very common problem these days because it is caused by stress and overworking, plus so much of adulterated food items and way of living also, lifestyle problem. He has really elaborately explained us how we can stay away from this problem. What precautions should we take, how to avoid it, and how to save the good bacteria in our body with probiotics, and which fruits to eat, avoid, or sometimes the milk products that also cause some irritability in bowel syndrome. And the yoga practice, as Dr. Sab said, the meditation, and so many asanas, which if we regularly practice, are definitely going to keep us away from this problem of IBS. So once again, I would like to thank you, Dr. Sab,